Before you dismiss this as just another rare virus story that could never affect you, I want you to imagine something for a moment. Imagine walking into your garage on a quiet Saturday morning. You open an old storage bin, sweep away a little dust, maybe move a few boxes that have been sitting untouched since winter. Nothing unusual, nothing dramatic. But hidden inside that dust could be microscopic particles carrying one of the deadliest respiratory viruses known to modern medicine. A virus capable of turning mild flu-like symptoms into life-threatening respiratory failure in less than 48 hours. And here is what makes this even more dangerous. Most people who become infected never realize they were exposed until it is already inside their lungs. Tonight, we are going to talk about a condition most people have never truly understood, even though health authorities have monitored it for decades. It is called Hantavirus Pulmonary Syndrome, often shortened to HPS. And if you are over the age of 60, this is a conversation you need to hear carefully because the aging immune system responds to this infection very differently from a younger body. I want to be clear from the beginning, this is not fear-mongering. This is about understanding risk, understanding biology, and understanding how prevention can save lives. According to data from the Centers for Disease Control and Prevention, Hantavirus pulmonary syndrome carries a mortality rate of approximately 38%. In some outbreaks, the fatality rate has climbed even higher. That means this virus is significantly more deadly than many infections people worry about every year. Yet most adults could not tell you how it spreads, what symptoms appear first, or what actions dramatically reduce exposure risk. And that lack of awareness is exactly why this conversation matters. If you are new to this channel, welcome. Here we focus on evidence-based health information, designed especially for adults who want to protect their health, strengthen their bodies, and make informed decisions backed by science, not fear or hype. Dr. William Li's work has consistently emphasized one critical truth. Your body is not passive. It has defense systems designed to protect you, repair damage, and fight disease when given the right support and awareness. But awareness always comes first. Before we continue, I want to ask you something important. Have you recently cleaned a garage, basement, shed, attic, barn, cabin, or any enclosed area where mice or rodents may have been present? Think carefully before you answer, because many people exposed to hantavirus never saw a single mouse directly. Exposure often happens silently through contaminated dust in spaces that seem completely harmless. Let me explain what this virus actually is. Hantaviruses belong to a family of viruses carried primarily by rodents. Different strains exist around the world, but in North America, the strain most associated with severe respiratory illness is called sin nombre virus. The name literally means virus without a name, and it was first identified in the early 1990s after a mysterious outbreak in the southwestern United States caused healthy young adults to suddenly develop catastrophic respiratory failure. Doctors were stunned. Patients arrived with what looked like flu symptoms, but within hours their lungs began filling with fluid. Many required intensive care. Some died within days despite aggressive treatment. What researchers eventually discovered changed infectious disease surveillance permanently. The virus was being carried by deer mice, small rodents commonly found in rural and semi-rural areas across North America. Now, here is the important part. The mice themselves usually do not become sick. They carry the virus naturally and shed it through urine, saliva, and droppings. Once these materials dry, tiny viral particles can become airborne when disturbed. Sweeping a floor, opening an old box, vacuuming droppings, even walking through a contaminated enclosed space can release those particles into the air where they are inhaled directly into the lungs. And this is where the biology becomes frighteningly efficient. When you inhale the virus, it travels deep into the respiratory tract and attaches itself to cells lining the blood vessels, particularly in the lungs. Instead of directly destroying tissue like some viruses, hantavirus triggers an extreme immune reaction. The body's own inflammatory response begins making blood vessels increasingly permeable, causing fluid to leak into the lungs. Imagine trying to breathe while your lungs slowly fill with fluid from the inside. That is essentially what happens during severe Hantavirus Pulmonary Syndrome. Now, I want to explain why older adults must take this especially seriously. As the body ages, several important protective systems naturally weaken. Dr. William Lee often speaks about the body's defense systems, including immunity, regeneration, and inflammation control. These systems remain active throughout life, but they become less coordinated with age. After age 60, immune surveillance becomes slower. The lungs lose elasticity. Tiny hair-like structures called cilia, which help clear debris and pathogens from the respiratory tract, become less efficient. Blood vessel integrity weakens. Inflammatory responses become less controlled. Researchers sometimes refer to this state as inflammaging, a chronic low-grade inflammatory condition associated with aging that can amplify how the body reacts to infection. This matters enormously with hantavirus, because much of the damage comes not only from the virus itself, but from the body's overwhelming inflammatory response. A younger immune system may regulate that response more efficiently. An older body may struggle to contain it once it escalates, and this helps explain why respiratory infections can become dramatically more dangerous after 60. Now let us walk step by step through how symptoms typically develop, because early recognition can save lives. The first challenge with hantavirus is that symptoms often begin deceptively mild. The incubation period ranges from approximately 1 to 8 weeks after exposure, although most cases appear within 2 to 4 weeks. At first, people commonly experience what seems like a standard viral illness: fever, fatigue, muscle aches, chills, headaches, sometimes nausea or stomach discomfort. One unusual clue physicians watch for is severe muscle pain in large muscle groups, particularly the thighs, hips, and lower back. Patients often describe feeling unusually exhausted or weak very early in the illness. At this stage, almost nobody suspects hantavirus. Many people assume they have influenza, a cold, or seasonal illness. Some attempt to recover at home, but beneath the surface, the virus is already triggering inflammatory changes in the vascular system. Then comes the dangerous transition. Usually within several days, breathing symptoms suddenly begin worsening. Patients develop shortness of breath that progresses rapidly. The lungs start accumulating fluid. Oxygen levels fall. The heart must work harder and harder to compensate. Some individuals deteriorate so quickly they require intensive care within 24 hours of severe respiratory symptoms beginning. This is why immediate medical attention matters. There is currently no specific antiviral cure approved for Hantavirus Pulmonary Syndrome. Treatment is supportive: oxygen therapy, intensive monitoring, mechanical ventilation when necessary. In severe cases, ECMO support may be required, essentially using an external machine to oxygenate the blood while the lungs recover. The earlier doctors recognize the condition, the greater the chances of survival. And this is one reason awareness matters so much. Physicians cannot diagnose what they are not considering. If someone develops severe flu-like symptoms after potential rodent exposure, that information should be communicated immediately. Now I want to tell you about something many people misunderstand. Hantavirus is not spread casually like a cold in most North American cases. You are not typically catching it from sitting beside someone at dinner. The primary transmission route is environmental exposure to contaminated rodent waste particles. That means prevention focuses heavily on environmental safety, and honestly, most people clean rodent contamination in exactly the wrong way. If you remember nothing else from tonight, remember this: never dry sweep or vacuum rodent droppings. Sweeping or vacuuming contaminated material launches viral particles into the air, where they can be inhaled deeply into the lungs. Instead, health authorities recommend a wet cleaning approach. If you encounter rodent droppings or nesting material, first ventilate the area thoroughly. Open windows and doors for at least 30 minutes before entering whenever possible. Wear gloves, and ideally an N95 respirator mask. Then, spray contaminated areas with disinfectant or a bleach solution and allow it to soak for several minutes before carefully wiping material away with disposable towels. Everything should be sealed in plastic bags for disposal. Simple steps like these dramatically reduce aerosolization risk. And yet, many people never hear this information until after exposure has already occurred. Now, I want to talk about risk factors because some environments create much greater exposure potential than others. Rural cabins closed for long periods, barns, sheds, crawl spaces, storage units, abandoned buildings, woodpiles, seasonal vacation homes, farming environments, campgrounds, areas with visible rodent infestation. Risk often increases during warmer months when people reopen closed spaces after winter. Research following outbreaks in the southwestern United States found that many infections occurred after individuals entered poorly ventilated, rodent-infested structures that had remained closed for extended periods. The danger is often invisible. No dramatic warning sign, no smell, no obvious contamination, just microscopic particles suspended in air. And that invisibility is exactly why prevention habits matter. Now, here is something hopeful I want you to understand before we continue. Fear alone is never the goal of good medical education. Knowledge changes outcomes. The majority of people will never develop Hantavirus Pulmonary Syndrome, but understanding how it spreads, recognizing symptoms early, and knowing proper cleaning precautions dramatically reduces risk further. Dr. William Li often emphasizes that the human body possesses extraordinary resilience when we understand how to work with biology instead of ignoring it. Prevention is one of the most powerful forms of medicine because once severe respiratory failure develops, treatment options become limited and difficult. Your awareness tonight is already part of prevention, and in Part 2, we are going deeper into the science most people never hear about. We will discuss why some individuals become critically ill while others experience milder disease, how inflammation spirals out of control inside the lungs, the role of the vascular system, the connection between aging immunity and respiratory failure, the real-world mistakes that increase exposure risk, and the exact prevention strategies every household should implement immediately. Because the most dangerous thing about hantavirus is not just the virus itself, it is how easily people underestimate it before it is too late. What makes Hantavirus Pulmonary Syndrome so terrifying is not simply how dangerous it can become, it is how normal everything feels right before the collapse begins. Many patients describe the early phase almost casually at first. They feel tired, a little feverish, maybe some body aches. Some assume they caught the flu from a family member. Others believe they simply overworked themselves cleaning a garage or lifting heavy boxes. Very few people imagine that a microscopic virus inhaled days or weeks earlier is quietly triggering one of the most aggressive inflammatory reactions the lungs can experience. And this is exactly why understanding what happens inside the body matters. Tonight, I want to take you deeper into the biology of Hantavirus Pulmonary Syndrome, because once you understand how this virus behaves, the prevention strategies suddenly make much more sense. Dr. William Li often explains disease through the lens of the body's defense systems: immunity, inflammation control, vascular integrity, tissue repair. These systems constantly communicate with one another to maintain balance. The problem with hantavirus is that it disrupts multiple systems simultaneously, especially in aging adults whose biological reserves may already be reduced. Let us start with the blood vessels because this is where the real danger begins. Inside your lungs are millions of microscopic air sacs called alveoli. Their job is simple but extraordinary. Oxygen enters these sacs when you breathe in and passes into the bloodstream, while carbon dioxide leaves the body when you exhale. For this exchange to happen efficiently, the barrier between air and blood must remain incredibly thin and stable. Hantavirus attacks the cells lining nearby blood vessels called endothelial cells. But interestingly, the virus does not directly destroy large amounts of lung tissue the way some infections do. Instead, it triggers an overwhelming immune response that makes blood vessels abnormally leaky. Think about your blood vessels like a carefully sealed irrigation system. Under normal conditions, fluid remains contained inside the pipes. But during severe hantavirus infection, inflammatory chemicals essentially loosen those seals. Plasma begins leaking out of blood vessels and into surrounding lung tissue. The lungs slowly fill with fluid. Now imagine trying to breathe through a sponge soaked in water. That is what patients experience during the cardiopulmonary phase of Hantavirus Pulmonary Syndrome. Oxygen levels fall rapidly. The heart strains to compensate. Breathing becomes exhausting. Many patients describe an intense sensation of suffocation or air hunger, unlike anything they have ever experienced before. And unfortunately, this deterioration can happen with shocking speed. Researchers studying severe HPS cases observed that some patients progressed from mild respiratory symptoms to complete respiratory failure within less than 2 days. This is why early medical attention matters so much. Now let us discuss why older adults face unique risks. One of the most important concepts in aging biology is physiological reserve. When you are younger, your organs possess excess functional capacity. Your lungs can compensate more aggressively under stress. Your immune system responds faster and more flexibly. Your cardiovascular system tolerates inflammation more efficiently. But after age 60, reserve capacity gradually narrows. Dr. William Lee's research and discussions about health defense systems repeatedly emphasize that aging does not mean the body stops protecting itself, but the coordination between systems becomes less resilient under extreme stress. With hantavirus, that reduced reserve can become critically important. Lung elasticity naturally declines with age. Respiratory muscles weaken. Chronic low-grade inflammation increases. Blood vessels become more vulnerable to injury. Conditions like hypertension, diabetes, cardiovascular disease, and chronic lung disease may already compromise oxygen delivery before infection even begins. So when fluid starts accumulating inside the lungs, the older body often has far less margin for compensation. And this explains why prevention is infinitely more powerful than treatment after severe illness develops. Now here is something many people never realize. Researchers believe much of the damage during HPS comes not only from viral replication itself, but from immune dysregulation. The body's own inflammatory response spirals beyond control. Immune cells release signaling proteins called cytokines, intended to fight infection. But excessive cytokine activity increases vascular leakage even further. This phenomenon is sometimes described as a cytokine storm. Instead of controlled defense, the immune response becomes chaotic. Inflammation accelerates, fluid leakage worsens, oxygen levels collapse, and this is one reason supportive intensive care becomes so important. Doctors are often trying to stabilize oxygen delivery long enough for the immune system to regain balance. Now I want to address a question many viewers probably have right now. If hantavirus is so dangerous, why do relatively few cases occur? The answer comes down largely to exposure patterns. Most people are never heavily exposed to contaminated aerosolized rodent particles. Infection usually requires specific environmental circumstances involving enclosed, contaminated spaces with poor ventilation. But when those conditions exist, risk can increase dramatically. Researchers investigating outbreaks discovered common patterns repeatedly appearing. Closed cabins reopened after winter, storage sheds with rodent infestations, barn cleanouts, attic renovations, garages with accumulated droppings, vacuuming contaminated nesting material, sleeping in rodent-infested structures, and disturbing long undisturbed dust. Many infections begin during ordinary household activities people never perceive as dangerous. And unfortunately, older adults often perform these tasks alone. Now I want to talk about one of the most dangerous mistakes people make after discovering rodent activity: panic cleaning. Someone notices droppings and immediately grabs a broom or vacuum cleaner. That reaction feels logical, but scientifically, it can create exactly the exposure conditions the virus needs. Dry sweeping launches microscopic contaminated particles directly into the air. Vacuum cleaners without specialized filtration systems can aerosolize particles even more aggressively. This is why wet disinfection matters so much. The CDC recommends soaking contaminated material thoroughly with disinfectant before removal because moisture prevents particles from becoming airborne. Ventilation matters too. Fresh air dilution significantly lowers airborne particle concentration. Simple measures can radically reduce exposure risk when applied correctly. Now let us discuss symptoms again, but this time from the perspective of escalation timing, because this is where many lives are either protected or lost. The early phase often includes fever, chills, fatigue, muscle pain, headache, nausea, vomiting, and weakness. But then comes the transition physicians worry about most: shortness of breath, especially rapidly worsening shortness of breath following possible rodent exposure. Patients sometimes describe feeling unable to take a full breath. Others report chest tightness, dizziness, rapid heartbeat, or severe exhaustion from minimal movement. This is not the moment to wait and see. This is emergency room territory. One reason mortality remains high is that early symptoms mimic many common viral illnesses. By the time severe breathing difficulty appears, lung injury may already be advanced. If exposure history is communicated immediately, doctors can monitor oxygen levels aggressively and transfer patients earlier to facilities capable of advanced respiratory support. That information can change survival odds dramatically. Now I want to speak directly to anyone over 60 watching tonight. Please understand something important. Awareness is not paranoia. Being informed about risk is not fearfulness. Modern health often focuses almost entirely on medications and treatments after disease develops. But one of the greatest medical advantages any person can have is understanding preventable exposure before illness ever begins. This is exactly why public health education matters. And honestly, this principle extends far beyond hantavirus. Dr. William Lee's broader work consistently returns to one powerful idea: the body responds to environment continuously. What you breathe, what you eat, what you expose yourself to, what you ignore, what you prevent, all of it shapes long-term health outcomes. Now let us discuss practical protection strategies every household should know. Number 1. Control rodent access points. Mice can enter openings surprisingly small, sometimes less than the width of a coin. Seal cracks around foundations, pipes, doors, vents, and utility openings. Store food securely. Remove clutter where rodents nest easily. Number 2. Ventilate closed spaces before entering. Cabins, sheds, garages, attics, and storage rooms should be aired out thoroughly before cleaning or extended occupancy, especially if rodent presence is suspected. Number 3. Use proper protective equipment. N95 respirators provide dramatically better airborne particle filtration than ordinary masks. Gloves reduce contamination transfer to the face and eyes. Number 4. Disinfect before cleaning. Wet surfaces thoroughly before removal of droppings or nesting materials. Number 5. Never underestimate symptoms following exposure. Fast action saves lives. Now, let us talk briefly about survival and recovery, because there is important nuance here. Not everyone exposed develops severe disease. Some individuals experience milder infection. Others recover fully after hospitalization. Intensive care medicine has improved significantly since the first recognized outbreaks in the 1990s, but recovery can still be prolonged. Survivors sometimes report persistent fatigue, reduced exercise tolerance, lingering breathing limitations, anxiety, and weakness for months afterward. Severe respiratory failure places enormous stress on the body, and older adults may require extended rehabilitation to regain strength. This again reinforces the importance of prevention over treatment whenever possible. Now I want to mention something deeply important before we finish tonight. One of the greatest dangers in health communication is extremes. Some people ignore every warning entirely. Others become overwhelmed by fear. Neither response is helpful. The goal is balanced awareness. You do not need to live in fear of opening your garage. You do not need to panic every time you see a mouse, but you absolutely should understand how exposure occurs and how to protect yourself intelligently, because knowledge changes behavior. Behavior changes exposure. Exposure changes outcomes. And in infectious disease medicine, small preventive actions often create enormous differences later. Tonight you learned what Hantavirus Pulmonary Syndrome actually is, how it spreads, why respiratory failure develops, why aging bodies face unique vulnerability, what symptoms demand immediate medical attention, and which prevention strategies matter most. That knowledge alone already places you in a stronger position than millions of people who remain completely unaware. And perhaps most importantly, remember this. Your body is not fragile simply because you are aging. Yes, biological systems change with time, but awareness, preparation, intelligent prevention, and rapid action remain extraordinarily powerful at every age. The goal is not fear. The goal is resilience. If this conversation helped you understand hantavirus more clearly, type "aware" in the comments below. I genuinely read the responses because understanding what concerns people most helps shape future discussions on this channel. And if you know someone who spends time in cabins, garages, sheds, farms, storage units, or rural properties, share this information with them tonight. Sometimes the most important health decisions are not dramatic medical interventions. Sometimes they are simple moments of awareness before exposure ever happens.